Well, it was an aha moment for me the day I brought it into my practice because I had been using lasers before for many years, CO2 lasers and diode lasers. And when I heard that there was this laser that did hard and soft tissue, as soon as I brought it in my practice and I started using it, I could see that aha immediately. And then going on years from that, I've been using Solea now for almost a decade. Every time there was some sort of improvement to the process or the technology, another aha hit. So for me, it's been a constant aha moment for the last decade, and I can't imagine practicing without it. Where Periodontal really filled the gap for me was when we would have those periodontal situations where it wasn't responding like we wanted it to, or it was more than just a simple scaling and root planing could actually address. So in those situations, what we were doing in the past was we were referring them to a periodontist. If they didn't want to go to a periodontist, our hands were tied a lot, really. And at that point, we were kind of just trying to manage these really deep pockets and these periodontal situations that many times, in all honesty, would eventually lead to extractions. This kind of filled that gap where I could actually treat them within my office, which my patients always appreciate. But I can actually address those pockets that are deeper, 6, 7 plus, or non-responsive to a traditional scaling and root planing alone. For my patient, it was huge because they could have this person who they've already developed a relationship over the years be able to treat it effectively and not have to be introduced to a whole other office environment that they may not have that same level of trust. My patients have really appreciated Perioguide in that after the surgery, they don't have stitches. They don't have the discomfort that they would have in the same situation where there would have to be complete like flaps opened and debrided and cleaning going that way. But they're more appreciative of the fact when they actually see the results and they see that it actually worked. Because it seems like it's not that much different than a scale and a root planing, honestly, from the patient's perspective. But the results are where it really has that big bang for them and for me too. Simply for treating periodontal disease, that was great. Now, when you add the other applications with crown lengthening and things like that, it just kind of makes it even an added benefit. I mean, there's all these different specialties in dentistry with the Periodontal that just came out in a sleep application, all these different applications you can use this. The thing that is different from a lot of other technologies out there is the fact that you have such a wide breadth of places you can use it. And that's why when I say I have it in my room every time ready to go, that's why I have a Solea for every provider that's working, so that whatever they're doing, they have that instrument in their belt. Because frankly, it's an instrument in my belt that if you took away from me, I would really have a hard time practicing dentistry every single day. I've become that reliant on it.